Thanks to ECCO Health, I no longer have to worry about the practice. No longer have to have a practice manager, and I'm able to go home and sleep without a lot of stress, anxiety regarding what's going to happen tomorrow.
With the scheduling service provided by ECCO Health, what I've noticed, and this is my experience in the last few months, that this is a service this is like a virtual office outside of the office, and that is the best part. So I don't have to worry about having somebody in the office who will take care of incoming calls for scheduling patients. And I can clearly say that based on this new service that I've started, my patient compliance with follow-ups has increased tremendously.
The biggest benefit I see for the patients is that, unlike before when a patient calls and my office staff is overloaded with calls, it went to a mailbox, and at this moment it transfers basically directly to ECCO office, which means that the call is answered usually in less than 30 seconds. With that, that's a great patient benefit and experience, and increases patient satisfaction for the office significantly, and obviously that reflects well on the physician as well.
Prior to ECCO office, I had numerous complaints regarding my referring physicians who would say, hey, we tried to get a patient in and it was almost impossible. We tried scheduling an urgent patient and we couldn't get a hold of him. And then since the initiation of ECCO office, I'm able to prioritize these patients. My referring physicians are happier. They state anytime they need to talk to me, they call through ECCO office and are connected right to me. If they need a patient in on the same day, our scheduling staff has parameters and can get them right in. So patient satisfaction and physician referral satisfaction has increased tremendously.
Me and my associate, Dr. Fanning, we have different styles of working, and ECCO Health scheduling service has customized both mine and Dr. Fanning's requirements. Dr. Fanning wants things certain way, I want things certain way, and I think when the scheduler finds out who the physician is, they automatically customize the needs of the doctor.
So from the point of view of a physician and owner of a practice, I think the biggest return for ECCO office for us has been better patient satisfaction, because patients are better attended to, and I think you save significantly also on personal cost, because if we would compare the staffing I need to answer all the phones in comparison to outsourcing this task towards a company which is professionalized to do that, I think there's also a monetary return on this.
Our phones would ring an average of every 30 seconds, and our staff was busy putting patients on hold or arranging authorizations, etc. And when patients would check out, they would be very busy and would not give enough time to patients. Since the initiation of ECCO office, they are dealing with patients who have become more satisfied. They've developed personal relationships with the patients, and they know the majority of the patients on a first-hand basis. The phones are no longer ringing, and ECCO office has saved us a majority of time and energy.
Previously what was happening was I was losing a lot of follow-ups of the patients that I had seen in the hospital, and the primary reason for that was that the in-house scheduling service was not able to receive calls effectively and schedule the patients. Therefore I was not able to follow up some of them, and therefore not happy with the whole thing. But with the new service, I think that problem has been largely solved.
Patients have described our initial contact as very favorable. When they speak with ECCO office, they are greeted with a very good customer service greeting. Usually there's no wait times for holding, and all questions seem to be answered at the time of the initial conversation. This translates into customer satisfaction when they arrive to the office. This translates into patients being very happy, and their expectations are met at the front door.
The workflow since we hired ECCO office improved significantly because the attending to the patient is not any longer interrupted with phone calls. So as an example, when we had a patient checking out in the past, sometimes we get calls, or we got calls which interrupted basically the interaction with the patient because the calls had to be answered, because in parts the staff didn't want to answer a lot of or listen to a lot of phone messages at the end of the day. And I think that interfered with patient satisfaction in our office, and that significantly improved since then.
I think it's a big plus. I don't have a Spanish-speaking facility in my office, so if at least I can get good service from ECCO as far as scheduling is concerned, at least I have one less hassle to take care of.
My staff is very pleased. Since the initiation of ECCO office, they have one-on-one time with patients. They are able to answer all questions. They're able to give out our emails, so if patients do have questions, they can respond by email. They are able to have just a great interaction and also have discussions regarding social issues about patients' families, patients' children, patients' grandchildren, and patients are very pleased. Prior to ECCO office, this was not possible.
As an additional advantage I see since we hired ECCO office, the fact that the phones are answered much faster and more consistent, that reflects well to our referring physicians. I'm a specialist. I depend on being able to see patients on a adequate way, that physicians have the impression or feel that their patients are taken care of. And a big part of that is the phone system. If a patient who is referred can't get through to us, we may not see the patient. That reflects bad on us as specialists, and may even reflect bad on the actual referring physician, because the patient may have the impression the primary care doctor sends me to a bad physician just because the phones were not answered.
As a service, we previously had four to six employees with an office manager overseeing everyone. Since the initiation of ECCO office, I'm down to 2 employees, and we have the ability to, ECCO office has the ability to accommodate a heavier workload or a lighter workload, depending upon the number of patients that I need to see that day, the number of questions that need to be answered, and the amount of scheduling that needs to be performed.
When a patient calls in for a prescription refill, there's a separate option for prescription refills, and the call gets basically directly routed to ECCO office, and they go ahead and fill the prescription based on the guidelines which we provide to ECCO Health.
I have done some testing myself with the ECCO scheduling service, and I have found them to be very cordial and very helpful. So I'm sure when the patients call them, they're also the same.
Since we have ECCO office, I think the patients feel more attended to than in comparison to before, simply because we get much less calls which have to be answered by the staff in the office.
So with the initiation of ECCO Office, we've set various parameters that if a patient needs to get in the same day, or if a physician feels like she needs to get a patient in emergently, that they can directly contact me or my office manager. Therefore, if a patient is sick or care needs to be expedited, they can have a same-day appointment through various goals which have been set through ECCO Office. In addition, most patients and office managers from other groups have said that our process is very efficient. There are no hold times. If there are any questions that cannot be answered, we're able to answer them via email or simple phone conversation. And ECCO Office has allowed us to streamline our productivity as well as patient scheduling.
I was very excited because I was having such a hard time with the previous scheduling, which was an in-house scheduling, that I wanted to definitely try it. And since I've had good experience with ECCO on other issues like billing, etc., I immediately said yes. And I sat with Jim for maybe 10-15 minutes and set some basic rules, and a couple of days later I was live and the system was live. So it didn't take much time, and it turned out to be very easy to set up and use.
So as a summary, since we hired ECCO Office, the staff is happier, physicians are happier, and that translates in happier patients.
Initial contact is very important because it sets the bar and it leads to expectations that patients may have. In a very large city such as ours, patients want the best care and the best service that is available, and when they talk to ECCO Office, they're very pleased, they're very happy. We've had no complaints.